current health emergency, members of the public are reminded to keep a safe distance of 6 feet from others while in public places to reduce the spread of the coronavirus. Please help us keep you safe. Thank you for your cooperation.
First week or so, I experienced anxiety that I never had in my whole life. I woke up early in the morning before I wanted to get up, and I was very, very anxious.
It's been very, very difficult because we are totally inundated in this area. Elmhurst Hospital has been hit very, very badly. My staff and I are working 18 to 20-hour days, 7 days a week since this started.
Unconscionable. The bodies are left in the morgues. The bodies are left in funeral homes. They can't get a burial, so we wait and we wait and we wait. We wait for 3 weeks to finally get an appointment date when we can bury. What a disgrace. I wish that we had a better outlet on the other side to deal with these bodies easier, so we didn't have to drive to Syracuse. So we didn't have to wait for weeks to get a cemetery spot. I wish that we're taking in a tremendous amount of work. I want that work to go out easily, not to be worried every day of whether we're going to have 20 bodies in this place for way too long.
They don't let you see them at the hospital. You can't go in and see them. We weren't able to have visitation here at the funeral home, so you can't see them here. You can't see them at the crematory. You can't see them at the cemetery. You know, in some cases, it's been a couple of months that they haven't seen their loved one, and they're just left with this kind of empty feeling, I guess. It's tough. It stinks. It's been tough. I've tried to take as many photos as I can for people. Sometimes the bodies are just in rough shape and they don't really allow for me to take a photo. Other times I just don't always have, I didn't always have the time in the beginning when we're helping so many different families to start. To try to take a photograph of 300 different people, first I have to clean them up, and make them look as presentable as possible. People are dying in unfortunate conditions, and I don't like sending a photo like that is not going to be the closure that they're looking for.
When this whole thing started, these cemeteries failed us, and they still continue to fail us because they're not taking the numbers that they're capable of doing. St. Charles Cemetery, for example, in the beginning, cut their numbers down to 8 a day. They should have been able to handle 30 a day.
These bodies that we're picking up are not embalmed. So fortunately, they've been in refrigeration for a week or maybe longer, so they're pretty solid. Eventually, they're going to thaw out, and then they're going to start to decompose. So we prefer to have these guys loaded on a truck when they're still cold and preserved. We don't like to have these bodies sitting around if they're going to decompose. That's why that guy in Brooklyn got in trouble. He was pulling in bodies and wasn't taking into account you only have a certain number of days.
There was blood leaking out. Very bad. Very bad. They've been doing this for weeks now. They're filling up the tractor trailer with bodies, U-Haul trucks, and they're letting them sit on the street. I didn't know what they were doing was illegal or anything. I don't know nothing about that, you know. I just know that these bodies been carried out all month long in body bags.
Hey, you understand that?
Yes, I understand.
Are the police there?
No, not yet. We just go on the way.
Okay, all right.
So
This is gonna take 6 or 8 hours before everything gets cleared.
Oh,
All right, so
okay.
you're just gonna be patient. There are some funeral homes that are not equipped to hold a large volume of bodies. Not that I'm really equipped here, but I have the room and availability, and we're doing it properly. And I only bring a loved one in here when we have the proper room and we know that we have a cremation date or burial date. Otherwise, we leave the body at the hospital because it's safe, it's in refrigeration.
Yesterday we got 25 bodies out to Syracuse. We loaded on a truck last night, and one of the funeral directors here drove them up to Woodlawn Crematory in Syracuse, New York. And then today we're just starting all over again. We're packaging the bodies that we have in the building and placing them in the chapel where the other bodies were yesterday, so now we have room to start another batch of 25. We've been getting about 50 to 60 bodies out weekly here since this pandemic started, and that's just the cremations. It's not including several burials that we've already had and entombments.
I'm retired. I've been retired for 10 years. And when this started, when it started to get, I would say, out of control, my brother asked me to come in one day and help him with the funeral. And I came in and I helped him. And then when I saw how bad it was, how overwhelming it was, I said, I can't sit down at home doing nothing when they're in here just inundated with folks that need help.
We're tired, but there's a lot of work to do, and it's our job, so we're gonna keep going. I hope that's not another customer. So, but you know, it was worse several weeks ago. I mean, that sound was incessant between the fire and police and EMS. It was eerie.
This has all been an experience for all of us. I'm old and I'm tired, I'm grouchy, and it's been one heck of an experience.
I clean before I get in the car, I clean after I get in the car. Usually on days like today, I was in a couple of trailers. And it's cold in there, it's highly unlikely that the virus is living in there, and we're not there that often. It's not like we're rubbing up, but just to be safe, I just soak everything in hot water with disinfectant, let it sit, and then I put it on the heater and it dries, then I'll wear my second set of scrubs the next day or third. And my phone, I disinfect because I often have to pick up my phone in the car and then I forget that I just touched and then I'm putting it to my face. The gear knob, the steering wheel, the stretcher handles, the covers itself, the inside of the stretcher, that we clean.
You know, I have a small staff of 4 guys, but we're working like crazy and we're all exhausted. So we're hoping this is going to come to an end soon, but it doesn't look like it. I mean, personally, it's just exhausting. I'm working with a team of guys and we're doing the best I can, and we're a team. As much as I'm the owner and the boss, I don't do anything without consulting them because I don't want to put their lives in danger. If they want to call it quits, they know, just tell me, Joe, we don't want to do this anymore. And the door gets locked, the phones get taken off the hook, and we're done.
It's our job. I mean, this is why we exist. We should be out there. You know, it's like saying, well, the police, fire. I mean, they have to be out there. They're licensed. They're credentialed professionals. You know, and we're the ones that should be out there.
In a situation like this, we have a job to do. You step up and do the job, and that's it. That's the way we live. That's the way we work. You just step up and do the job.